how has your normal job duties been affected by the epidemic?
um, so I guess it depends on all of our own social media feeds, but for many of us in healthcare, I'm sure other industries too, there is like memes of like someone trying to drink from a fire hose, and it's like processing the 30th new or 300th new policy, in the last 7 days, right? We're just flooded with, this is how you have to do. Oh, wait, no, the next day you have 5 new policies. And so being on that policy side of things, like we kind of joke, we're like, oh, it's a drinking game, for every new policy that comes out, and you're hammered. It has been a really heavy sensory information overload, accompanied with a ton of fear of wanting to protect not only the responders and like the doctors, nurses, paramedics, all essential services of postal, food workers, those in the travel industry that don't get a chance to sit down with like, whoa, people are suffering economically. Some folks are sitting at home. Not only, I think the uncertainty is what really is hurting people now. And how do we balance that for the vulnerable populations that we need to protect? So it's a hot load of a lot of information, competing priorities, not knowing if you're making the right call, and everyone's going to be mad at you no matter what, which I guess that was actually normal in my job. So I'm used to that side of things, because you just can't please everybody. And, but I think this was an immediate call to action is we had to communicate clearly, accurately, often. And that's the only way we're really going to survive this, because we have to continue to communicate and connect. I mean, I think the isolation is just as much as a virus as everything else that we talked about. So lots of changes, but I think we're in a spot where we're going to get through it.
So you say, what does that look like? How do we get through this? What's the other end of the mountain for us?
I think we have to take a moment and ask, what do we want for our lives? I think we're mourning, there was a great article out of the Harvard Business Review talking about that uncomfortable feeling that you're experiencing is grief. Right now, we're watching a world grieving. We're grieving the norm that we have lost. The norm that we've always known is no longer here. Now, maybe we didn't like that norm, because there's a hot load of folks who aren't working, making more money on unemployment than they ever saw from an employer that maybe wasn't treating them respected in a loving way.
Mm-hmm.
But they're still mourning of interacting, within that normalcy. And so I think that this is a moment for us to ask, what is meaningful to us? What do we want? Do we want to connect with family or friends? Do I want to be able to be self-sustained? Do I want to learn how to garden so I'm not, at the mercy of these vulnerable food systems? What makes me happy? And I think that's what we have to ask ourselves right now.
Do you think there's how many cases, or what does the curve look like for us to, or maybe the nation to feel like, okay, we could start opening up businesses? Because here in Texas, we tried that. We're going to be the pioneers of making mistakes. Everything is bigger, even the mistakes in Texas. And we are paying for it big time. And they might lock it down again. We could have been done by now, but, they got greedy. I've heard some scary predictions out there saying, hey, it might take 2 years, before there's a Lollapalooza again, or, we're going to Coachella or big NFL games and stuff like that. That's going to impact everything. And I know business runs everything, but it's hard for me to picture, okay, what is the end, or when can we start pumping off the brakes on that?
Yeah, 2 years, I would say, would be at the earliest.
Earliest?
COVID is not going to go away.
Wow.
What we do see, this is what my physicians are reporting to me, is that the disease is already mutating. So as the scientists learn stuff about COVID, they're watching it change already. It's contagious like the common cold. I mean, imagine a world without the common cold. We wouldn't have that conversation, right?
Mm-hmm.
And so, I'm glad I brought up that grieving thing, is because like what I hear in your question is, when are things going to be normal again? You're asking for, when's life going to be like life 6 months ago? It will never be like 6 months ago. And that's why we have to redefine, what do we want the next 6 months to look like? What do we want the next 6 years to look like? Are we ever going to get together for a concert? And yeah, okay, there's going to be a concert. Whether it's folks rebelling against public health agencies or not, we're going to get some live music. At what cost? The war on drugs didn't stop people from doing drugs. So, what I mean?
Yeah.
As humans, we're going to adapt. But the real conversation is like looking forward versus looking behind. And I think it's human nature for us to talk like that. Like, when are we going to get back to our normal? And I think the big challenge is we just need to redefine it. And so then also what I hear in your question is, when are we going to get mobile again? When can we connect and interact and kind of have that in-person energy? Because that's what these concerts and these sporting events give us, right? We get flooded with that energy and we get rejuvenated to go back to our lives of working late hours and writing policy that doesn't seem as glamorous as Lollapalooza. And I think we're going to find new ways to like pull that energy, and it'll happen, but it's going to be new. And so this is the time for those of us that are really creative to really shine.
Whew. That was a little gloomy, I ain't gonna lie, but I appreciate the honesty. I was like, man, I hope she say next week. But okay. Oh man, that's terrifying. But you're right though. I think the redefinition of normal is we're gonna have that tough conversation or realization sooner or later, because that's just the nature of our reality.